Hello and welcome to the Metabolic Health Conference 3.0. I'm Priyanka Matanhelia, a member and a certified metabolic health coach from D.life.in, India's first and the only award-winning low-carb platform. D.life was founded in 2014 by Anup Singh, a silver medalist from IIT Roorkee and the recipient of Icons of India Award. Anup is the pioneer of the low-carb movement in India, with his path-breaking protocol of 100-gram carbs per day max that made not only LCHF, but even type 2 diabetes reversal possible for Indian vegetarians. In 2021, D.life launched its diploma course, which is the only course in this segment approved by the NSDC partner, Government of India, and the only course with 144 hours CPT credit. Anup Singh and Shashikant Iyengar are the co-organizers of this metabolic health conference. So for our session today, we will discuss the topic India as the diabetes world with Dr. Parth Samal. A brief intro to Dr. Samal. Dr. Samal is a practicing diabetologist who is also a metabolic health coach certified by D.life, author and a YouTuber based out of Jharsuguda, Orissa. It's great pleasure for me to talk to Dr. Samal, who actually both of us joined the course around the same time. And so we've participated in the community group and know a little bit about each other from before. So really looking forward to this discussion. So before we move further, I would like Dr. Samal to tell us what inspired your journey from a mainstream practicing doctor to acquire a certification in metabolic health coaching.
Okay, am I audible?
Yes.
Yeah. Thank you, Priyanka, for the sweet introduction. And I feel honored to be a part of this program. So now answering to your question, I come from a very strong medical background. Deeply influenced by the family legacy. Actually, my late mother was a doctor. My father is a retired physician, still giving his services whenever required. So I have grown up in an environment seeing patients, the pain and frustration a patient has to endure, listening to stories from our father about a patient's ordeal when he suffers from any kind of a life-threatening disease. So I always made it a point to take up a holistic approach in order to reduce the number of medications and of course its side effects. So through my practice, after a few years, I started observing that the medicines I'm prescribing for any kind of a lifestyle metabolic disorder, after some time, I needed to increase the dose of the medicines, the number of the medicines, right? So with this, I was also increasing the cost of the treatment. There are a lot of people. I have people from, I get patients from all walks of life. I have got patients from as a daily wage earner to night shift worker to businessmen. So imagine those people who have a fixed source of income. And imagine that 1/3 of the income was going into the treatment. So that's painful, right? So whenever there is a patient who suffers from any kind of a metabolic disorder and with the complication, the cost of the treatment goes very high, right? I was determined to find a solution, to find out such a method of treatment, such a modality of treatment that will not only enhance my practice, but primarily improve the health of the patient, improve the energy level of the patient, right? Lower the side effects from the medications, and of course, the cost of the treatment. So I did a lot of courses. I did naturopathy, breathology, all the courses. And my search came to a turning point when I came across an ad on social media by Satyajit Das, a low-carb nutritionist, a wonderful coach, and he happens to be my mentor, my guru in the field of nutrition. I got immense knowledge, immense insights how to handle metabolic diseases from his course. Seeing my interest in nutrition, he suggested me to join D.life. I joined D.life, did the course, and I got an exposure to so much knowledge from the brilliant minds, from the brilliant professionals in D.life, this led me to numerous successful stories where people have, you know, stopped taking insulins, which they were on for past 10 years, 15 years, stopped diabetic medicines, thyroid medicines. I've seen reversal of fatty liver disease from grade 3 to grade 1. I've seen obesity, losing weight, obese people losing weight. So this was a wonderful, and this is how from a conventional doctor, I became a doctor and a metabolic health coach. So this was my journey.
Okay, very interesting. I must mention that Satyajit Das is also a D.life member and a
D.life
coach
member. Yes,
from
yes, yes.
D.life.
Yeah.
So yes, it's quite a quite interesting to see that not only people like us who have suffered from certain metabolic health issues, but doctors like you are also interested in taking this path and introducing your patients to low carb style lifestyle. So, Dr.
Right.
Path, today, there are an estimated over 220 million people in India who have diabetes. This amounts to about one quarter of the world's total. So, in your experience, what do you think is contributing to the rise of diabetes and other lifestyle diseases in India? And especially, if you could talk about your small town, Jharsuguda, because, even there, these cases are rising.
Yeah, absolutely. So, see, the rise of diabetes in India is multifactorial. The first one I would say is a change in the lifestyle and diet. So, if you see, since the past 3 decades, our food culture has changed, right? We have shifted from a whole food culture to a fast food culture.
Yes.
And the food environment we are living in does not match our biochemistry, right?
Mhm.
So you'll see that the consumption of processed and ultra processed food has gone up. Processed food, no nutrition, nothing, only blank calories and preservatives that can only spike your blood sugar level, right? So the increase in the consumption of processed food in India and a place like Jharsuguda, where I stay, I've seen more patients in the past 10 decades who are suffering from autoimmune disease. The cases of allergy in children and adults has increased. Cases of diabetes and other lifestyle metabolic disorders has increased. Cases of gut problems has increased exponentially, right? Now, then the consumption of carbs, refined carbs, and sugar has increased. Consumption of unhealthy fat, that is refined oil, seed oil, has increased, which contains a lot of omega 6 fatty acids that is purely inflammatory in nature. And diabetes is a metabolic inflammatory disease. It adds on to the inflammation which already there in diabetes. The consumption of alcohol has increased. Consumption of sweetened beverages, soda has increased in children. I see people, young children, buying, soda cans, the energy drink, you know.
Right, right, right. Yes.
So that kind of a culture has come up, and the consumption of healthy fat and protein is has gone down. And
True.
I'm surprised that in India, 90% are protein deficient, and most of the people don't know that how much protein their body needs per day, right?
Mhm.
So this is one of the things. Another reason I feel it is stress. Stress has immensely increased, and we already know the relationship between stress and metabolic disorder, stress and obesity, abdominal obesity, and the relationship between stress and addiction, right? The next I feel is sleep deprivation. Most of the patients whom I handle who are metabolically sick are sleep deprived. And I stay in a place which is an industrial belt, right? People do night shift works. So imagine a person who does night shift work on a regular basis or at least 15 days a month and having a metabolic disorder. It becomes challenging to manage that kind of a patient, right? Because whatever food, yeah, whatever diet you will prescribe, right? They cannot adhere to it because of the erratic timings of work. And the most important thing, that circadian rhythm has gone for a toss, right? And the Next reason I would say that we have stopped using our muscles. Nature has given us muscles to be used, right? And muscles being the 40 to 50% of a human body mass and stores around about 80% of sugar, whatever we eat. That's a big reservoir of fuel. We are not using it, right? So I say to my patients, see, muscles are the currency of longevity. The more the muscles you have, the longer you will live, right? So that thing has decreased, which is also, increasing the number of diabetes in India and at my place, Jharsuguda, of course. The next I would say is genetics, of course. Yes, genetic studies has proven that South Asians, including Indians, have a higher propensity to accumulate fat around the abdomen. That makes them insulin resistant because our ancestors, they have adapted to this technique of survival for the bad days when they were food deprived. Sorry, when they were food deprived, the body has taken up this technique of survival to store fat in the abdomen because the fat in the abdomen breaks down to fatty acids and gives energy faster and has got a direct connection with the liver through the portal veins. So we have a term called toffee, thin outside, fat inside. This was coined by Dr. Jimmy Bell from Imperial College of London. So this characterizes the way an average Indian male looks like, skinny outside and having a potted belly, right? So Indians are more predisposed to insulin resistance. And the next I would say is misinformation and, ignorance and
Yes.
misinformation. I see lots of videos on YouTube and podcasts on social media where people and celebrities, they talk about nutrition and health without a scientific base. I think half of the population in India, they don't know what is right and what is wrong and what is good for them and what is not.
Yes, I think that stresses the point that people need to talk to certified health coaches, like, or
Absolutely.
go to platforms like D.life.in where they can get genuine information, which is science, evidence backed information from professionals so that, these confusions can be cleared. And that is why
Clear.
we are having this metabolic health conference. So, Dr. Path, very briefly, because, it is also reported that, I was reading that 50% of Indians who have diabetes are unaware of their condition. I think,
Right.
a lot of times people actually miss out that they are experiencing signs and symptoms of diabetes. So, if you could briefly enumerate for our audience, what are the signs and symptoms people should look for when they have diabetes? To know that, okay, they might have diabetes.
Oh, okay. So basically, what happens that diabetes, as we know, is a slow progressive process, right? It takes time. So initially, you may not find any kind of symptom. Now, talking about signs, we see signs of insulin resistance. Like you may see dark patchy skin around the neck or on the forehead or on the cheek. We call it acanthosis nigricans. That's a sign of insulin resistance, which forms the basis of type 2 diabetes. You'll see skin tags around the necks. If any person who identifies this sign, it's high time he should connect to a very good nutritionist or a good doctor, educated doctor. Now, talking about the symptoms, the classical triad like frequent urination, increased in appetite, increase in thirst, these classical symptoms generally we don't see often, right? Most of the time, what we see is generalized weakness, fatigue, blurry vision, dizzy feeling, unexplained weight loss, frequent infections, non healing wound, then tingling sensation, numbness, anesthesia on the feet and palms, infertility, erectile dysfunction, loss of hair in the extremities, legs and hands. So sometimes, most of the time, we see this kind of symptoms for diabetes.
So when patients come to you with these symptoms, like you said, so what do you advise them to do? What kind of tests do you do, and how do you advise them to move forward? Because as you said, that these symptoms are just for insulin resistance; they are not like full blown diabetes. So at this stage, what do you advise them to do?
See, once seeing the patient, you know that he is metabolic sick or not. So before handling a case, I always go through the following tests. The first thing is the glucose panel, that is fasting blood sugar, that is 8 hours overnight fasting. Then the blood is taken to find out the sugar level. Then is the postprandial blood sugar, that is 2 hours post meal. Then you have HbA1c, glycosylated hemoglobin, which is done once in 3 months to find out the glycosylation of hemoglobin because of the sugar load. Then I recommend fasting insulin and C-peptide, which most of the doctors and nutritionists don't recommend. Now, why I do so? Because the fasting insulin, it 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 tells you about the level of insulin resistance in the body,
Mhm.
right? So, as I said, that insulin resistance forms the basis of type 2 diabetes. So, finding out the level of insulin resistance is more important before, organizing a plan of treatment, right? Then I do lipid panel. For some people, I do advanced lipid panel. As diabetes is a metabolic inflammatory disease, we need to see the inflammatory markers, right?
Mm.
The level of inflammation in the body. So ESR, HSCRP, and homocysteine levels has to be checked. Then diabetes is a disease which I think affects almost all the cells of the body, all the organs of the body. So there are some organ specific tests like the liver function test, kidney function test, and almost all the diabetic patient or any person who is metabolically sick, I see a general trend of low vitamin D3 level and low vitamin B12 level. So these two vitamin test, I get it done. And of course, urine routine micro and an ECG if there is some comorbid conditions like high blood pressure since say more than 1 year. I do an ECG. And of course, if there are more comorbid conditions, if the patient had an attack or is suffering from angina or any kind of a heart problem like cardiomyopathy, I always send them for a complete cardiological evaluation before I can start a proper treatment.
Mhm. Okay. I think this is very valuable because nowadays a lot of people, they say that they don't have diabetes, so they don't need to, go on a low carb diet, etc. And I think there's a lot of misinformation, as you pointed out earlier. So if you could also briefly explain, what are the different stages of diabetes? Because, insulin resistance is something people think it's normal. Like it is something that is normal with age. It's not something that is related to a metabolic dysfunction in the body. So if you could just briefly explain as to what is the stage and what stage insulin resistance is there
Okay.
and what needs to be done, and how do you
Oh,
basically tackle your own patients, if you could just throw light on that.
okay, so basically we have four stages. The first stage is the onset of insulin resistance. This is the compensatory mechanism by the body. You won't find any symptoms at this stage, but if not taken care of, they quickly go into the next stage, that is the hyperinsulinemic stage, where the fasting insulin level goes up, right? Now, uh, here what happens that the insulin level is high. You will find people are gaining weight. They are going into reactive hypoglycemia. Some patients I see fasting blood sugar is like below 70 or below 80, or postprandial blood sugar is below 100. So seeing such kind of a report, any doctor nutritionist will say, okay, you need to have more food because the sugar is less. Now that's where the problem starts. We are putting that patient, by giving such an advice, we are increasing his insulin resistance, right? Because we haven't checked his fasting insulin, right? So this is the hyperinsulinemic stage. So some people may have a high blood pressure. Some people may have a high triglyceride level. And, you know, such people, the people in this stage, I have observed they become very irritated when they feel hungry. And once fed, they feel lousy, lethargic, sleepy. Right. So, okay, so this is the second stage. And in the second stage, if we don't take any step, that gradually takes us to the third step, that is the diabetes stage. Well, many authors say that that is pre-diabetes, diabetes, but frankly, in my experience, I've seen people who were pre-diabetic in just a matter of months, 3, 4, 5 months, I've seen them to become frank diabetes, the symptoms. Right.
Mm.
So it doesn't take time transitioning from a pre-diabetic to a diabetic stage.
Mhm.
So diabetes, you have all the symptoms. Now, what happens that at this stage, if the patient is prescribed medications that will increase the insulin level in order to control his sugar, and he is given that medication for a longer period of time, so slowly his beta cells will start getting exhausted. They will start making lesser insulin. So then comes the fourth stage, which is called the insulin dependent stage of type 2 diabetes. I have a lot of patients who are so much insulin dependent because they were treated with a drug, high dose of drug for years together.
Mhm.
So they become insulin deficient, and I had to put them on insulin for some time. So these are the four stages of diabetes.
I
And
think
yeah,
yeah, I think you've explained it very well, because I think that also explains why the, trained doctors also need to study metabolic diseases through a metabolic health approach, which we do here at D.life. And as you know, when you were explaining pre-diabetes and diabetes, I was reminded of when I joined D.life. Anup used to say that uh, there is nothing called pre-diabetes. Either you have diabetes or you don't have diabetes. So I think that was a very good insight, because I think uh, conventional doctors look at diseases in a very, very prescribed or very, jacketed manner in which they've been trained. But we need fresh thinking and fresh way of looking at these metabolic diseases, so that we can tackle all the symptoms together. So that brings us to, I would like to know, what are the treatment options do you usually suggest to your patients, and how do you go about the treatment of, when they present themselves with these symptoms?
okay. So any patient who is below 45 or 50 years of age, having an HbA1c of below 9, without any comorbid conditions, I never prescribe them any medications. I put them on a diet. I put them on a low carb diet just for 3 weeks, not more. And I tell them that, okay, let's retest your blood parameters after 3 weeks, after 21 days time. Once they do the retest, they see the improvement, and they are convinced that yes, this diet is going to work for them. So you need to build the confidence whenever you're prescribing anything. Only then the diet will become sustainable. And if the patient is diabetic and has other comorbid conditions, then I will always do a thorough evaluation. I'll put them on medications if required, but with a low carb, healthy fat diet.
Mhm.
Now, just yesterday, I had a patient, 60 years of age, with only hypertension, newly diagnosed diabetes, 4 months back at our place. And I had given her a diet and told her to recheck after 21 days. But because of some reasons, circumstances, she could not turn up. And she comes to me after 3 or 4 months. Like, I didn't prescribe any medication apart from some supplements. Okay, but she took care of the diet. And then 3 or 4 months back, when she had come, the HbA1c level was around about 8.9. And after 3 months, when we retested, she was on 6.8% without any medications, only on diet, on low carb diet. Right. So this is how I handle my patients.
So that's,
Yeah.
that's a great insight. Actually, I think you have planned some success stories to tell us as to how your patients have benefited from the low carb diet approach. So can you share some success stories? I'll put that.
Yeah. Please. So this is very close to me because the first the first slide I want to show is
Yeah.
that of a 31 years old lady, right? She was 84 kgs. I remember when I started her treatment, I had just joined D.life, right?
Mhm.
So it was just a few months, and so I was handling this case. So this lady was 84 kgs. She had come to me because she was newly diagnosed, type 2 diabetes and hypertension. And she was undergoing a treatment for primary infertility because she was married for 8 years and she was unable to conceive and had PCOD. So the gynecologist said that, okay, you need to consult a good diabetologist. She came to me and we started her therapy. After 21 days, repeated the test, good improvement. And I told her, you have to continue this. I was there all through the 7, 8 months when she was on low carb, did online consultation, hand holding, everything. After 7 months, she comes for a consultation and I'm unable to recognize her. From 84 kgs, she had dropped down to 63 kgs. And after 9 months on low carb, she conceived, and this year 2025 she gave birth to a healthy baby weighing 2 kgs and 400 grams. Her HbA1c was 8.8, and now when we tested for the second time it was 5.5. And the interesting thing is, all through her pregnancy she didn't require any metformin or insulin, which we generally prescribe during the diabetes in a pregnancy. This is a beautiful, lovely family. This is a complete family. So this case is very close to me. Another case I want to share is of an 86-year-old lady who had a bouquet of conditions. She was type 2 diabetic. She had hypertension, lipid panels were, totally distorted, hypothyroidism, fatty liver disease, cardiomyopathy, and of course bronchial asthma, which had shifted to COPD by now. So I started a treatment. I started a treatment, her HbA1c was 7.3% and very high insulin level, above 22 or something. And when we started her treatment, after 2 or 3 months, I stopped her insulin. After 5 to 6 months, we had stopped all her anti-diabetic medications and statins. By the end of our treatment, the HbA1c, which was 7.3, it had come down to 5.9 or something, 5.6, 5.9, yes, 5.9. And she is still without any medications. It's almost more than a year. And she celebrated her 87th birthday just a week back.
Wow.
And
That must be very satisfying. I can
absolutely.
see the picture, like she looks really happy with you. Okay. And I think you
So
have another case
another
study.
case, yes, this one is a type 2 diabetic patient. He is type 2 diabetic since 2010. He had sleep apnea problem and hypertension. When he came to me, his HbA1c level was 11.9, and I started him on low carb. Rechecked after 3 weeks. Okay, he was doing well. So I told him, of course, there was regular consultation with this patient, and after 8 months, he had lost 11 kgs. His
Wow.
HbA1c had dropped to 5.7%. The last medicine which I had given was metformin 500 milligram, which I had stopped a couple of weeks back. So these are some of the cases which I had to handle through low carb.
Wow. That is really incredible. I think you've shown, like, three different case studies of different age groups,
Age
different
groups, yeah,
genders, different, lifestyle contexts. I think that will convince the audience that yes, low carb is not just for a particular section of people who are living in the metros, who have access to, very, high level, I mean, advanced level of groceries, etc. It's actually very much possible in the, Indian context, for people
absolutely.
living in small town India. So I think, on that note, if you could, explain to us a little bit about how do you convince your patients to, follow the low carb diet? Like, what do you tell them, like how to design the diet, and what kind of tips do you give them? What is the process?
Oh, yeah, great question. Before prescribing any kind of a diet, there goes in a lot of education, actually. I spend a lot of time with my patients. New patients mean I take around about 1 hour, 1 hour, 10 minutes in educating them. So the first thing they need to understand, I need to remove their ignorance. I need to clear their misinformation. You know, so the first thing I explain them is about the macronutrients, the carbohydrate, fat, and protein. See, it's important to understand that we can live without carbs, but we cannot live without protein and fat. This is the first thing a patient should understand, right? So we have so much, we have so much become carb addicted that it is difficult for a lot of patients, because in my place, we eat a lot of carbs. A general thali looks like 50 to 70% of carbs, and with that, a lot of people taking a second serving of a rice or roti, right? So here it is very important to understand that carb is not essential as like protein. The building blocks of protein are amino acids. Now we have essential amino acids. Fats, the building blocks of fats are fatty acids. We have essential fatty acids, but we don't have an essential carbohydrate. So this is the
Right.
first thing I put this information into my discussion with the patient. And talking about protein, I mean, people have lots of misinformation. Now, a lot of people think that dal is rich in protein. Now, Priyanka, if you take any kind of dal which we use in Indian cuisine, take any kind of dal, 100 grams of any dal has approximately 20 to 25 grams of protein and 50 to 80 grams of carb. It is a carb rich food. It is not protein rich food. What
Also,
people,
people cannot eat 100 gram of dal. I mean, it will lead to problems.
you know, so then I talk about fat, then we have been over consuming the unhealthy fat, that is the refined oil, the seed oil, rich in omega 6 and inflammatory in nature. I shift them to a more healthier option like desi ghee, makhan, or virgin coconut oil. So a lot of in education goes on into this with examples and all this. Till I feel the patient is not convinced with his diet, I keep on working on that patient.
So, in terms of protein, because I think protein is one of the very, there are a lot of myths, as you said, floating around, what kind of protein people should consume. So, if not dal, what do you recommend to your patients? What kind of protein sources can they have?
So that basically depends upon what kind of a food they are following, what kind of a diet they are following. Are they vegetarian, non-vegetarian? I always see the cost and accessibility, whether they can get protein, they can buy the protein or not. And the next is what is the purpose? What do I want to achieve in this patient? And the parameters of the blood, every all these things, uh,
Mm,
on these basis, I decide how much gram of protein is required. So
mhm.
for vegetarian people, the best protein is the dairy protein. You have cheese, you have paneer, you have hunkered. And for non-vegetarians, yes, we have seafood, egg, fish, chicken, mutton, all this stuff. And egg being a complete protein, and anybody you get it everywhere actually. So I always, tell people to have eggs if it comes to protein.
Mhm. So, when you talked about, another problem with protein, which Indians, as you talked about, cost and accessibility is an issue. And since you work in an area where, there are people from all walks of life, so how do you address this challenge when there are cost issues? I think you were telling me some stories. So,
Yeah,
if
yeah, yes, yes. So, see, I have got a patient who is type 1 diabetic. I could correct her, and they cannot afford a high class protein every day. It is understandable. And being a type 1 diabetic and a tribal, she couldn't afford insulin also. So, generally, I do the test, the treatment free of cost, give her insulin free of cost. Now, what happened? We could correct the carb, but we could not correct the protein part. So I called her parents. We had an elaborate discussion uh, about the food culture, what they used to have in veg, non-veg, and all. So the father tells that they sometimes have these snails, snail meat, and sometimes they have dry fish. Well, okay, that's good. It's rich in protein. You can have that. And believe me, when we really worked on this girl with type 1 diabetes, she was taking 64 or 65 units of insulin. Now she has dropped down to 22 to 23 units of insulin,
wow.
right? Through diet. So this is, I mean, like, see, whenever I want to prescribe a diet, I need to see everything. Not only the blood parameters, I need to see how comfortable it is. Do I need to make a drastic change, or I'll make it gradual, right? So a lot of factors matters when I prescribe a diet actually.
I think this story really, tells us that it shows us that, culturally we are, I mean, our food culture, our ancient food culture, our native food cultures are so, actually were quite low carb, as you said about snail meat and dried fish. I mean, they are getting eclipsed now with the onslaught of these
Snails
modern.
are a delicacy in a lot of places.
Right. And with the onslaught of all these modern packaged food products, so I think we need to revive that, So that's a very, very
Agreed.
interesting story. But as you said, that there are a lot of challenges when it comes to adoption of low
Yeah.
carb.
Yes. Yes.
So if you could highlight some of the challenges that you face, like you explained one, but um, what are other challenges that you face, and how do you address them when it comes to low carb diet, adoption of low carb diet by your patients?
The first one we already discussed, that is misinformation and ignorance about that. That needs proper education. The second I see is the fear of hypoglycemia. Imagine a patient on insulin and multiple anti-diabetic medications who has already experienced, hypoglycemic episodes multiple times. He will never want to go into that episode again. So when I talk about low carbs, so they always are afraid of lowering their carbs because they might get into that kind of an episode, right? So I tell them that you need to check your blood sugar more often. It was not like till now, even a lot of people, they check their blood sugar once in 2 months or once in 3 months when they go to their doctor for consultation. So I explained them that you need to check it more frequently, and whenever it goes down, we will lower the dose of the insulin or we'll lower the dose of the medication so that you won't get into the hypoglycemic stage, right? So this needs a lot of hand holding and education, right? The next challenge I would say is India is full of religious celebrations and festivals and celebrations all throughout the year. And our religious celebrations and festivals, they revolve around high carb diet and sweets,
Sugar.
right?
Yes.
So it is difficult for people in this kind of a situation to adhere to the diet, right?
Mm.
The next thing I would say is the mental resistance, because at my place, as I said, that a normal thali looks like 50 to 70 grams of carbs. So if I tell them, okay, now you need to drastically cut your carbs by one fourth of what you are eating, there will be a mental resistance. He cannot think of that kind of a diet. So that
Mm.
has to be gradual. So I need to surpass his mental resistance so that he accepts the food, right? To
Mm.
make it more sustainable, right? And it is important that whatever diet we prescribe, it has to be sustainable. Otherwise, there is no point. The next challenge I face is the family support. See, if you are treating any kind of a metabolic disorder case, it's not a one-man show. It's
Mm.
it's it's a team effort. It's a team effort between the doctor, the patient, and the family members who support him. So whenever I consult any patient, I always ask them to come with their family members. Otherwise, I don't give a consultation. I I make it a point to talk to their family members so that they are also educated with the patient. Only then I know that okay, this diet I'm prescribing will be sustainable, right? The last thing, of course, yes, cost and accessibility. I told about one, cost and accessibility. I need to see that whether they can afford what I'm prescribing it or not. Otherwise, there is no point. And one more thing I would like to add here. Uh, as I said, I live in a place where it's an industrial belt, and lot of people do night shift work, right? Now, people who are into night shift works, it is difficult for them to adhere to a diet, to follow a diet properly. And with that, it is more difficult to control the manage their blood sugar because they have got erratic work schedule, right? Their circadian rhythm is totally distorted. So yes, this is challenging, but sometimes I see just making just few adjustment in the diet also gives wonderful results.
Okay, so I think we are almost nearing our time. We have some 3, 4 minutes left. So towards the end, what I would like to ask you is, as we know, across the world, especially I was reading in the UK, they have approved low carb nutrition approach as one of the line of treatments for diabetes. So in India, how do you see the role of low carb evolving? How should it evolve to, because see, in a small town, like you said, as a doctor, it has become very challenging because it requires a lot of intensive effort to educate the patients, but doctors in bigger cities cannot do that. So how do you see, how can we create this sort of treatment ecosystem for patients and in the healthcare system to address this the rising incidence of metabolic diseases?
Yeah, see, the thing is, I remember what Dr. Robert Lustig said in one of his interviews. See, if you want to fix the healthcare system, you need to fix the health first. If you want to fix the health, you need to fix the diet first. And if you want to fix the diet, you need to find out what problem is lying down in the diet, right? So doctors don't have so much time discussing all these things about nutrition because basically we are not prepared like that. We didn't have a completely different subject for about nutrition. So most of the doctors, they don't have time for that, and that's the treatment labs, I say. The nutrition part is totally completely not taken care of. So if we can collaborate the present healthcare system with a nutritionist, a low carb nutritionist, I think we are going to do justice to the people, to justice to the treatment we are giving. So although low carb nutrition is scientifically based, low carb nutrition can regulate your sugar, can regulate your insulin, can regulate your weight, can lower your inflammatory markers, can postpone or prevent the complication from a disease. And I would say the low carb community, the D.life community, you see thousands and thousands of successful cases who have been reversed or put into remission, right? So these numbers speak a
Exactly.
lot about what D.life nutritionists are doing for the world.
Exactly. I think you summed it up very well, that we need to create an ecosystem along with the, taking along, the mainstream healthcare professionals like doctors, trained nurses who are in the mainstream practice, and also, this new breed of metabolic health coaches who can partner with them and then create communities like, D.life, small chapters of D.life everywhere where, patients
True.
can find support
Agreed.
and they can get knowledge, proper knowledge. So I think with this, I would like to invite Shashikant Iyengar and Anup Singh to end the session. And hi, Shashi. Yeah.
Hello, Dr. Path. Thank you.
This is
Thank you, and thank you for coming and sharing your knowledge. And I think it makes a very big impact. And especially since you're from small town, you're bound to give a lot of very practical solution for many of us who probably cannot, where they will keep the affordability in mind. And we are seeing a lot of small tips you are given, and it's going to benefit the public at large. Not only those who are seeing the live stream today, but also probably in the future when they see the recording, they're going to benefit greatly from a practical experience. So thank you very much, and we will meet
thank you,
again.
sir. Thank you, sir. Thank you so much.
Please get Valerie in and Ira.